What you're looking at is obviously not a library, but a manual medical record of thousands of patients visiting the Connaught Government Hospital. And this is how staffs here trace the records of patients, a process that is painstaking.
When you go to a hospital, and they'll say, "What's your name?"
They will ask you your name, when last did you come here? They will send you to the records department. They will start looking for your chart, which will be very difficult.
And it will be even very difficult. Sometimes if you are even lucky, you will see your card. That is after 5 hours, maybe by the time you come.
That was 3 months ago when Dr. Kapua, hospital care manager, painted a picture of the everyday struggles of patients and staff without a digital system in place. The reality unfolded right in front of our eyes as a patient who prefers not to be named shares his experience after 2 weeks without being seen.
I came here last week Friday.
I came here last Friday for a medical issue, and I have not been attended to yet. They asked me to come today, and I have been here since morning. I was interviewed again, but my papers are still not yet ready. I have been sitting here for 3 hours in one place, and I am very hungry.
Right now they feel angry.
And he feels an electronic system could ease the discomfort he and many others go through.
An electronic system will be better for us.
Connaught is the biggest government hospital for general health issues in the country, but the hospital over the years has faced a fair share of its challenges. Long queues and hours of waiting without seeing a doctor was common here. But things are changing around here with the migration from manual to electronic medical record system, as Ijatu Bar shares experience with the new system compared to the old one.
Before the system, health workers will just tell you to wait, but with the new system, it is much better. Healthcare workers are more efficient now than before, with the help of the system in place.
This has not only made things easy for patients, but it has increased efficiency in the hospital, helping health workers in carrying out their duties within the shortest possible time.
It's effective and it's fast. It's more faster than before. It's fast.
At all costs, 10-15 minutes, you can able to examine patients and you go direct to the point, the exact need, what is actually happening to the patient. You give the impression, then you can able to keep those records in the computer as well.
Before the system, issues of confidentiality and safety used to be an issue here.
Confidentiality. When we do all these chats, some of you have been to our wards, you see them on the table. So let's say the nurse in charge has gone maybe in the restroom, for example, yeah, and I am there to look for patient X, and I see it, I'll just take it, or I'll just make a snapshot. Many of us have seen things like that on the social media, where we take these snapshots and put them there.
While talking about the advantages of the system, Dr. Kapua shares how the system works.
We tagged it to so many other factors. Number one, we tagged it to either your last name or your telephone number or your NIN that is being done by the NCRA. Yes, so all of those one of those criteria you could be named. You could come with your last name, but we know last names can be a lot. Say for example, Kamara, we have a lot of people with that name. But we know you have, for example, Mohammed Kamara with the telephone number 073 and all of those. So, or your NIN, you are the only one that has access to that or that has that. So once you put that in the system, and then all of the data about that patient will come up. It will show you when last the patient was seen, who was the doctor that saw that patient. So it makes it very easier.
Even with the changes the system has made, there are still challenges that need to be addressed.
It's good, but it's slow because of the lights. Because the light system for now is poor, but the system is good.
We started having issues with connectivity, internet connectivity. You know, sometimes the speed goes up and comes down, and so we were having issues with that.
With the piloting of such a system in the biggest hospital in the country, it is hoped that the system will be cascaded to other hospitals in the country for seamless operation, especially making referrals easier with an interoperable feature. This report is produced under the DPI African Journalism Fellowship Program of the Media Foundation for West Africa and co-developed. Joseph Johnson, AYV News, Freetown.